Did you talk to therapists when you did this?
Yeah, a lot of therapists.
Yeah. How many of them agree with you?
So there was a huge split. The academic research psychologists overwhelmingly agreed. They were aware of the literature and they said, yeah, these are bad practices. Here are things we shouldn't be doing with kids. What was interesting is a lot of the clinical therapists were either minimized the risks of therapy or denied that there were any.
But isn't that like Jiffy Lube? Like when you tell them, you don't need to change your oil that much. Well, it's their business to change oil.
Right. Exactly. So like I talked to this one amazing, child psychologist who said to me, I start by having my patients sign a waiver in which they acknowledge that there can be risks. And the reason I do that is because I don't want them to experience harm. So if they see that their worries are getting worse, they have to tell me.
But do they? Would they? I mean, it seems like the therapist is the one who's in control, right?
Right.
The therapist is the expert. They're the one who has the authority.
Right. Well, I mean, this one was Camilo Ortiz was one of the, he was the one I talked to, and he was the one that I was referring to there. And first of all, he always starts a therapy by setting the number of sessions. It's not, he doesn't treat a kid like an annuity. You're going to, be my income stream for years.
Right.
He attacks, and also they come to him with an actual problem, like chronic bedwetting, like, various kinds of phobia. Mm-hmm. There are people who treat anorexia. They're tackling a problem.
Right.
And some of those therapies are extremely necessary and very successful.
When this person that you were just describing, if they get someone that comes to them that doesn't have a real problem, do they turn them away?
Well, you can ask, but very often the therapists don't turn them away. That's the problem.
Right.
Too many therapists. I mean,